So I'm here with Deidra. Deodra's a 34-year-old lady who had scoliosis surgery done how long ago?
4 weeks now.
4 weeks ago. And so one of the things that we talk about a lot with our patients, with our teenage patients and our many young adult patients, is the timing for surgery. So if you could just tell a little bit about your story, your scoliosis story, and maybe what advice would you have for other young ladies that are facing this? We can see your x-ray behind us there. You had a 54-degree thoracolumbar scoliosis pre-op, and there you are now. And how much height did you gain?
2.5 inches.
So you're getting into the supermodel range then.
I know.
So anyway, just tell a little bit about your story, and then what did you learn through this experience that might be helpful for other young ladies or men that are facing this?
So when I was about 14 or 15, I found out that I had scoliosis. It was in about the 30-degree range, S-curve. And I was told that it would not progress as I got older and out of puberty. Unfortunately, we recently found out that it progressed to the 54 and then the 31. And I had to get surgery. I would say if you find out when you were younger, definitely go ahead, get the surgery. It's not going to get any better. It'll get worse. The pain, the level of activity that you can do decreases. Your just whole aspect of life just gets worse. So I would definitely, my best point of advice is do it as early as possible, and you will need the best at-home nurses, family, friends, husband, mom, dad, mother-in-law, father-in-law to take care of you. It is worse in your first 3 weeks. You'll have some tears, you'll have happy moments, sad moments, but it definitely gets better.
That's good. Well, thank you for sharing. So before it led up to your scoliosis, was your quality of life going down?
Yes.
And what kind of pain and symptoms brought you to the point where you considered having surgery?
I have an 11-year-old, so a lot of stuff that she wanted to do, I was just not able to do, or the pain would go from a 3 to a 10. Just everyday activity like work. I have a sitting job. I couldn't sit long. I'd have to get up, move around, come back. Just say a night out on the town. Couldn't do that. Couldn't go out to dinner and do something fun. And it just got to the point where no medicine was helping, and it was just something had to be done.
Mm-hmm. Did you try the Schroth therapy as well?
No, I did not try the Schroth.
Did we offer that?
Dr. Hay did offer that and told me that in the short term it would be beneficial, in the long term it would not.
Yeah, it can help, but it's not a guarantee. But your curve had progressed so much, and you were suffering so bad. I think it's reasonable to consider surgery. So remember I told you that for the kids bounce back really quick. They're back to school and sports in 3 weeks. But I said for the adults, especially when you get into your late 20s, 30s, and 40s, what did I tell you about the first 3 weeks?
Horrible.
That is a valley, right?
Gonna regret doing it, and there was sometimes
you're gonna be crying and saying, "I never should have done this," right?
And there were some days like that, but we're getting over that hump.
You're getting through that valley, right?
I'm definitely better than I was.
Okay, so at this point, are you glad you did it?
Absolutely.
But it took 3 or 4 weeks to get there. So if you are going to get it done as an adult, your doctor should tell you that there's that valley you got to get through, even a post-op depression. But most patients then are very glad they had it done. But curves that are over 30 degrees, remember we talked about that, have about a 70 or 80% risk of progression. Curves that are under 30 degrees are not. But those thoracolumbar curves like you had, even curves that are only 35 degrees when you're a teenager, have about an 80+% risk of progression. So at least get it followed as a young adult.
Yes.
And not ignore it. Would you say?
I would say.
And if you had to look back on it, you would have preferred to get it fixed maybe when you were a teenager or 20?
Yes.
As opposed to 34?
And I would have definitely kept up regular doctor visits to monitor it throughout my 20s, which I did not do.
Yeah, in my up-to-date chapter, which is available online, I talk about that especially if your curve is over 30 degrees, that you should try to get annual x-rays done through your teens and into your 20s or 30s, because we would have found that your curve was progressing and could have tried Schroth. And then maybe you fixed it when you were 18 or 20, as opposed to 34 when you got an 11-year-old and a job. So But anyway, thank you for sharing. This might help somebody else who's in your shoes, and also to encourage parents that if they do have kids with scoliosis, that even when you're graduating from the pediatric orthopedic surgeon, I take care of kids and adults, come to a place like this or somebody who treats adults and get that annual x-ray done, because 70 to 80% of those curves above 30 will progress. Curves that are above 50 degrees have pretty much 100% risk.
Right.
But a lot of those 30 to 40 and 40 to 50 degree curves, as you can test to, can progress.
Absolutely.
And does that cause suffering?
It does.
It can cause big suffering. Anyway, thank you for sharing, and we'll put this up so somebody else can learn, all right?
Thank you so much.
All right, take care.